Hi, my name is Tasha and I'm going to be performing the remediation for the intramuscular injection video. I was asked to start the video at the hand hygiene portion. I have performed hand hygiene and I have applied my clean gloves. I do have to let you know that I am currently, I have COVID, so I'm trying to get over that. So I'm not really feeling well, so I might have to cough or sneeze outside of the video. So again, I have performed hand hygiene and I have applied my clean gloves. You do want to make sure that you have all your supplies, which I already have here. You want to make sure that you have the correct gauge and length of needle and the size of syringe, and that's going to be the 3 milliliter syringe. I have my 22 gauge 1 inch needle, and then I have my blunt tip so I can draw up the medication. If you were preparing this medication in a different room, you'd want to label it with all the patient information, then initial, put date, time, and name of medication. I will again check the EHR and compare the orders to the medication I have on hand. I will prepare the medicine by removing the cap if there is one on there, and I would wipe down the rubber top clean with an alcohol swab. You're going to want to fill your syringe with the medication by adding the appropriate amount of air, which is going to be the 1.5. And you're going to want to inject that into your medicine bottle. And you're going to want to invert that and draw up the appropriate amount of medication. You will want to make sure that you get rid of any air bubbles. Let's see if you can see that here. And I have a 1.5. Again, you're going to want to compare that to your orders once again. You're going to want to change out your needle and discard that in the sharps container. And then you're going to put on your injection needle. You will want to look at the area you're going to be using and see if there's any bruises, inflammation, or any edema. If you see anything, you want to use a different injection site. You also want to palpate the site and avoid any areas that have any masses or tenderness. And of course, let the patient know that they might feel some burning or stinging during the injection. All right, so once we select the appropriate site, I am going to choose the ventrogluteal area. I am going to place my palm on the patient's greater trochanter with my thumb towards the groin and my index finger near the iliac spine. So it'll end up being like a V. And then you're going to want to inject that in the middle is how it's going to be. So you do want to clean your area in a circular motion for about 2 inches from inward to outward, and you want to allow it to dry and not touch the area. Once that dries and you have that area down, you're going to grab your syringe. You're going to want to hold it between your thumb and forefinger at the dominant hand like a dart with your palm down. Once you have your area here, you want to hold the skin tight so that the injection site that you're going in is held taut, and then you have it with your non-dominant hand. You are going to want to inject the needle quickly and firmly at a 90-degree angle. And then you're going to want to pull up on the syringe to verify that you have not hit any blood vessel or have any blood in the syringe. You're going to want to stabilize it. And then you're going to want to inject for 10 seconds. Okay, and once you've done that, you're going to also want to wait your 10 seconds before you withdraw the needle. Okay, so I've waited my 10 seconds. I'm going to carefully withdraw, and then I'm going to discard this into my sharps container. I'm going to place an alcohol swab or gauze gently over the site. You're not going to want to massage it, and you're also going to place a Band-Aid on there if needed. Never recap a used needle. You always want to discard the needle and any blunt needles into a sharps container. You're also going to remove your gloves. You're going to want to perform hand hygiene, ask the patient if they have any questions. You do want to monitor your patient and verbalize anything that happened and document. Thank you.